and I'm here at SIIM in Grapevine, Texas with Brian Casey, who's the editor-in-chief at Aunt Minnie. And the event's been going on for about a day. What are you seeing and hearing?
Well, there's a lot going on here at SIIM. It's a great meeting to focus, really tightly on the radiology space, on the PACS space. There's been a lot of discussion about vendor-neutral archives, a lot of discussion about universal viewers for giving people outside radiology access to radiology data. And one of the things that I think is interesting is there's been some discussion is about the concept of PACS, and do we want to still call it PACS? Do we want to go with imaging informatics? Is the idea of PACS seems very, very radiology centric, and medical imaging is really growing outside radiology. So, and the question is PACS still relevant now? So that's kind of been something that I've been talking about with a lot of people.
There's probably also been a lot of discussion about meaningful use.
Sure.
About the latest requirements, and how is this organization and the people who are here, how are they looking to try to meet those requirements?
Well, I think that there was a little bit of disappointment that radiology wasn't included in the stage 1 and stage 2 of meaningful use, and so the goal right now is to get medical imaging more involved in stage 3, which is, I believe, under development right now. So I think we're hoping that when stage 3 comes out, it'll address radiology and PACS a little more specifically and give people a little more guidance. But people are out there and they're getting meaningful use funds from the government for a testing, so that's a positive sign.
And patient engagement, are people talking about how to give patients access to their studies?
That's another really hot topic. We're going to be running an article by Dr. Sam Friedman, who's a radiologist. He runs his own blog. He's kind of anecdotally called the Dalai Lama of PACS.
The Dalai Lama blog. Yeah.
And he's written something on his blog about a patient that he saw who wanted to talk to him about her images, and at first he was like, oh God, what's this patient going to say? What are they going to bring in from their, searching the internet or something? And she said, well, I wanted to talk to you because I've received a lot of PET CTs over the last few years, and they're wanting me to get another PET CT. And do I really need that? And he took a look at her file, and he felt that some of those PET CTs were unnecessary.
Okay.
So this was a case where patient engagement, where an informed patient would help him make a better decision in terms of how to manage that. So, I think that radiology is kind of wrapping its head around the idea of patients having access to their own data, and I think that we're starting to conclude that it really could have a lot of benefits.
It's a brave new world.
It is, for sure.
Well, great. Thank you, Brian.
Sure.
I appreciate
Thank you,
it. And we'll be back with another report from SIIM and Grapevine. Thanks again.